Welcome back. I'm Dr. Sheik and I'm a licensed clinical psychologist. And today I'm going to talk a little bit about how do you find the right therapist for you. And I know there are a lot of therapists out there and there are a lot of resources or a lot of individuals to choose from. And sometimes that process can be very overwhelming. So I'm going to break down some of the elements that may be helpful for you in order for you to find the most effective or the most helpful therapist for you. Now, when we think about the term therapist, a therapist is a term that broadly refers to any mental health professional that have had some level of training and education in the field of mental health and carry some level of licensure in their state in order to practice therapy or to provide counseling to individuals. Now, this could be anyone ranging from a psychologist or psychiatrist, a social worker, a licensed practicing counselor, a licensed marriage and family therapist, or a drug and alcohol abuse therapist. Any of these individuals may carry the title of therapist. And the only difference between each type of therapist is the number of years in school and the amount of training that they may or may not have received while in school and outside of school. And also their licensure. That process is different for each one of those providers. The last thing that may or may not be different is their specialty. Now, when we think about how do you find the right therapist for you, the ultimate answer to that is it depends. And it depends on a lot of factors based off of what you're looking for. Now, do you want someone for medication management? Are you looking solely for mental health medication in order to manage the symptoms or to control your mood or the mental health struggles that you're dealing with through medication? If that's the case, then you're looking for a psychiatrist. One of the main differences between a psychiatrist and a psychologist is that a psychiatrist is a medical doctor and a psychiatrist is typically the person that prescribes medication or mental health medication. A psychologist cannot, in most cases, prescribe mental health medication. Now, they do, in most cases, understand the use of medications, what medications you may be taking, some of the side effects, and they may understand the medication in general because of pharmacology courses that they may have had to take or training that they received after being in school. So they may understand the medications, but they cannot prescribe them. And they are not the individuals that would make any changes to those medications. That would be a psychiatrist. Now, sometimes I hear people are upset when they meet with a psychiatrist and say things such as, all they talked about is the medication, the dosage, my side effects, how I felt, if I felt like I need to change in any medications or any of those things. If this has been in your experience, that makes sense. And it makes sense because not all psychiatrists provide psychotherapy. Not all psychiatrists provide talk therapy in any way. Some of them, for the most part, primarily focus on medication management. So when you meet with them, sometimes you will not get to meet with them for 45 minutes to an hour. You may meet with them for 15 minutes to 30 minutes. And what they're primarily focused on is your medications. How are the medications working? Are the medications addressing your symptoms? Do we need to adjust the dosage in any way? Do we need to titrate you off specific medications? Do we need to change the medications? What are your side effects that you're experiencing? That's primarily what psychiatrists are going to focus on, especially if they're not dealing with or they're not also practicing psychotherapy. Not all of them do. Now, it depends on what type of therapy are you looking for. Are you looking for supportive therapy? Now, supportive therapy typically means that your provider is meeting with you, talking to you about day-to-day stressors, how to manage and navigate day-to-day stressors. It's a space for you to vent. It's a space for you to talk things through. It's a space to learn some strategies, but primarily it's just providing support. It's a place for you to go and express your concerns and to talk about the things that you're dealing with each and every day that are concerns for you and how to navigate those concerns. That's typically supportive therapy, and not all therapists practice supportive therapy. Now, are you looking for someone who maybe specializes in analyzing your dreams or talking about defense mechanisms or understanding how your childhood and your experiences throughout life continue to impact how you're responding to your environment today? And they're going to primarily focus on those contributing factors that may have come from childhood that play a role in that expression of behaviors or emotions in your current environment. Then you may be looking for a psychoanalyst. A psychoanalyst is what most people think about when they think about a therapist, is what you think about when you see the therapist that's sitting behind you on the couch, just taking notes, that's writing down all the things you're saying or listening to you talk about your dreams and analyzing your dreams or analyzing your thoughts. That's typically a psychoanalyst, and not every therapist is a psychoanalyst. And if that's what you're looking for, that's the type of therapist you would seek out. And you may also be looking for someone who is focused on specific diagnoses diagnoses or specific types of treatments or specialties, such as trauma work or work primarily focused on anxiety or depression or social anxiety or obsessive compulsive disorder or eating disorders or any host of diagnoses that you may have, whether it's bipolar disorder or borderline personality disorder, then you may want to look for a specific type of specialist. So you may want to look for someone who's been trained in DBT. If you have a borderline personality disorder, you may look for someone who specializes in dealing with anxiety or depression and has some level of specialized training in those areas in order to help you. Can you go to a psychoanalyst for specific diagnoses and issues? Yes. But when you're looking for people with specific type of training, especially with things such as trauma work, most of the time you are looking for a specific type of therapist. And that might be someone who specialized in maybe prolonged exposure or EMDR or cognitive processing therapy, that's CPT, or cognitive behavioral therapy for trauma or ACT treatment for trauma. All of these modalities of treatment is something that someone may specialize in. So if you're looking for someone specifically to address certain areas, you may want to look for a provider that has some level of specialized training to address that specific concern that you're looking for. And lastly, you may be wanting to look for someone who's able to do assessment of you out as an adult or assessment of your children outside of the school setting. Then in most of those cases, you're looking for a psychologist, and a psychologist can do an assessment in order to determine if you have autism, if you have ADHD, if you have some type of personality disorder, or if your children are dealing with some type of learning disability or specifically some type of emotional or mood disorder that is getting in the way of them being able to actively engage in school. This is where you would seek out a psychologist in order to do those types of assessments. So again, it depends. And lastly, if you are not sure what you're looking for specifically, because not all of us have studied every aspect of therapy, not all of us go into this process knowing exactly what we want, I encourage you to meet with a therapist and discuss the concerns you're currently presenting with, the things that you are ideally looking for, and the things you may be wanting to change, the things you're wanting to maintain, the things you're wanting to focus on as it relates to you feeling like you have a greater level of mental health and mental stability. Then I want you to listen to or get a sense of how helpful this particular therapist would be, considering the things you've walked in to discuss. Does the treatment plan, does the process moving forward sound like something that would be helpful for you? Were you able to build somewhat of a relationship or a rapport with this therapist in the office? Did you feel comfortable with this therapist? That's some of those things that you can also rely on when you walk into an office. And I want you to always remember that it's never a time where it's frowned upon for you to say that this therapist does not work for me, or the treatment plan or the modality for treatment that they're using is not really helpful for me. I don't feel comfortable with this person. I encourage you to seek out a new therapist. And I know that is a hard process, and I know it's easier said than done. And trying to find someone initially that you actually are able to connect with in that way is hard. So I do understand that it is a difficult process to find someone or to continue to try to find a therapist that meets your needs. But I want to encourage you to actually put that time and energy into finding that appropriate therapist, because it makes a world of difference when you're able to connect with your therapist and you're able to see the growth and the changes that are happening within you, because you are meeting with someone that is actually helpful and is meeting your need. So I want to do like a short overview of some things to look for when you're looking for a therapist. One thing to look for is that the therapist is licensed in your particular state. And any therapist, you can look up their license. That's public knowledge. You can do a Bing search, a Google search, a DuckDuckGo search, and specifically search for a license of Dr. such and such, or a license of this particular counselor or social worker. Look for their licensure and make sure that they're licensed to practice in your state, and make sure that they're licensed to do the work that they're saying they're actually licensed to do. That's one. Another thing to be on the lookout for is what type of maybe specialized training or certifications that the therapist has received as it relates to those specialized training. So in most cases, if a therapist is specialized in certain treatments, whether it's prolonged exposure, cognitive processing therapy, relapse, exposure therapy, ACT, DBT, any of those have formal training processes. And when that training process is over, typically therapists receive a certification saying that they completed a specific training. I'm not telling you to go ask therapists for their certifications and if they're certified to do blah, blah, blah. What I am saying is if that's what you're going to specifically look for a therapist for, make sure that the therapist you are going to see does have those certifications. And I find it hard pressed to believe that a therapist would be offended about you asking about those certifications. I will hope that's not something they would get offended by. Now, what I hope you take from today's video is this. When you are trying to find the right therapist for you, there are some things to consider, and it all depends on what you're looking for, what type of therapy you're looking for, what type of therapist you're looking for, what you're hoping to get out of the therapy, what experience you're hoping to have with this therapist or with the therapy environment. What is the goal? Like, what are you trying to resolve? Are you just trying to talk about everyday stressors? Or are you trying to resolve an actual concern that you're having as it relates to mental health? And if you're unsure, when I walk into this therapy session and I meet with this therapist, do I feel comfortable with the plan that they have for me moving forward with therapy treatment with them? And if all the stars align and all those things match up and you are in the presence of someone you are open with and you feel like their treatment plan is something that's going to be helpful for you, awesome. I also want you to keep in mind to check their licensure, making sure it's active, seeing if they're specialized, if they've received the level of training in their specialty that you're looking for. And lastly, do you feel comfortable talking about the most intimate details about your life with this person that's sitting across from you? That's how you find the most helpful therapist or the right therapist for you. Is it going to be a short process? If you're lucky, yes. But for most of us, it is sometimes a longer, more drawn out process, and it may require that you change therapists maybe more than one time. But I do want to encourage you to take the time to make sure that the therapist is a good fit, and that might require one or more sessions with that therapist to determine if that therapist is a good fit for you. As always, please feel free to jot down any thoughts, questions, or comments you have below. I hope you've learned something from today's video. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.